Welcome, dear students. Program is Bachelor's of Arts, third year. Subject is Psychology. Semester is 5th. Paper code is PSC 105. Paper title, Understanding Psychological Disorders. The title of the unit that I'm going to present is Overview of Abnormal Behavior. The module name, Treatment, Psychosocial Approaches to Treatment, Part 1, Module number 09. I am Aldina Braganza, Associate Professor, Carmel College of Arts, Science and Commerce for Women, Nouvelle Goa. Today I will look at various types and basically 3 types of psychosocial approaches to treatment, that is behavior therapy and its techniques, cognitive behavior therapy and its techniques, couple and family therapy, and I will look at the effectiveness of these treatments. At the end of this module, you will learn to acquaint with different behavioral techniques which are suited for various mental disorders. You will get to understand cognitive and cognitive behavioral techniques best suited for various mental disorders, and you will acquaint with family and couple counseling techniques best suited for various mental health disorders. The first psychotherapeutic approach that I'm going to look at is behavioral therapy. Now, behavioral therapy falls in the purview of behaviorism. The proponents of this therapy are Ivan Pavlov and B.F. Skinner. Basically, behavior therapy revolves around the concept that learning is the core and is important aspect for both abnormal as well as normal behavior. So, the principles of classical conditionings are considered, principles of operant conditioning are considered, and basically these basic principles are used to remove unwanted behavior. The first therapy under behavior therapy is exposure therapy. Exposure therapy is used in classic cases of anxiety-related disorders, for example, phobias. In phobias, various techniques of exposure therapy is used, that is, the client is made to confront head-on with their object of fear. For example, fear of snakes. The client is asked why they feel this fear of snakes and then confronted with the idea of the illogical thought process that goes in creating this fear. Systematic desensitization uses the method of meditation to help the person calm down and systematically introduce the object of fear. Flooding uses a very different approach in which the person is flooded with various kinds of images and experiences of the object of fear. In vivo exposure, the person is taken directly in and given an experience. For example, if the person has a fear of snakes, then giving the opportunity for the person to handle non-poisonous snakes is a classic example of in vivo exposure. Imaginary is another form of exposure therapy in which the person is given a kind of a meditative experience and given different experiences in which they can imagine their situation of fear and learning to overcome it. Exposure therapy is largely effective with phobias and various anxiety-provoking situations. Another form of behavior therapy is aversion therapy. It is involved only in extreme cases. For example, when the person cannot use treatment for giving up alcohol consumption and has tried other methods but has not succeeded, then an aversion drug is introduced to this person, and every time the person feels like drinking, that kind of drug will make the person feel uncomfortable and discomfort. A snap method is used for giving up smoking, in which a rubber band is tied to the hand, and every time the thought of smoking appears into the person's head, the rubber band is sharply snapped, and that causes a kind of a discomfort. Painful electric shocks is another method and is used in cases of extreme behavior like pedophiles or rapists or sadists. And so they are shown images of young children, for example, in pedophile, and then which is accompanied by a painful electric shock. Modeling is learning new skills through imitation, works very well when dealing with adolescent problems. You require role models. Vicarious learning is learning through imitation, helping people when you use role models to help people deal with substance dependency. For example, when you use a role model like a famous actor to show that drinking is bad for health or smoking is bad for health. The next type of behavior therapy is operant conditioning. Here we use a systematic use of reinforcement to suppress unwanted behaviors or learn a new behavior that needs to be learned. For example, it can be used with substance abuse again, or dealing with young children to help them cope with various kind of problems that come up in classroom, like for example, gaining their attention. The techniques used are responsive shaping. Here, positive reinforcement is used by gradual approximation. A desired behavior, for example, not disturbing other students. The person is given an encouragement or asking questions in class. Every time somebody asks a question in class, the person is praised in front of his peers. Another form of technique of operant conditioning is token economy. Here we use different types of token allotment to shape desired behaviors. For example, it could be used in institutional settings like industrial setup where, for example, a certain kind of activity needs to be encouraged. Cognitive and cognitive behavior therapy. The key components involve understanding the cognitive processes that influence emotions, motivation and behaviors. We use a pragmatic hypothesis testing technique. Therapy is meant for intelligent and cognizant patient. The proponents of this therapy are Aaron Beck and Albert Elias. The most famous among these are rational emotive behavior therapy, which was put forth by Albert Elias. Here basically the person's individual's belief system and self-evaluation, which actually makes them look at life negatively, is reconstructed to a more positive outlook. Various irrational thoughts of should, ought and must that promote negative thinking are challenged, and use of various behavioral oriented techniques such as homework assignments. The person gets a chance to move from a negative outlook to a more positive outlook. It is very effective with decision making, dealing with self-esteem issues, and works with clients who are intelligent and can think logically. Cognitive therapy is, the proponent is Aaron Beck, and he basically looks at problems that arise due to bias processing of external events and looks at the cognitive schemas and that triggers these biases. This works very well with depression patients. You basically create an awareness of the illogical thought processes that we hold. Each of us hold cognitive schemas and biases which causes errors, and the therapy involves identifying and challenges these illogical errors. One way you do is look at selective perception, overgeneralization, magnifying of undesirable events, and absolutically. Effective with depression and anxiety disorders. Evaluating behavior and cognitive therapy, it achieved the advantages is that you get results in a very short period of time. Methods are very specific, they are easily measured and can be used in research. You can deal with various types of anxiety related problems, and Beck's therapy is very popular with depressed patients. The criticism for this therapy is that there is limited use of therapy, cannot use therapy where the problem is very deep and underlining, and the problem has to be well defined. Very ambiguous problems cannot be dealt with behavior and cognitive behavior therapy. The couples therapy is used with couples when there is distress between partners. Okay, they use a systematic approach. They believe that problems of one partner influences the other, and that is a cause of most problems. They use the techniques to use are traditional behavior, couples therapy, reinforcement of desired behaviors between couples, accepting the limitations of each other's behaviors, effective with couple therapy. Family therapy looks at distressed relationship with family members. Problems of one family members influences the others. Techniques are structural family therapy. Family members will behave more supportively with each other, and boundaries are defined. Dysfunctional patterns are altered. It deals classic cases are affected with codependency issues. I leave you with questions for contemplation. I need you to ask yourself, what was your favorite type of therapy and why? What therapy would work best for college students? Is substance use a common problem in the youth? What therapy would you think would work best with them? Thank you. I'll leave you with the references: Saracen and Saracen, Abnormal Psychology, and Carson, Butcher, Meneka, Abnormal Psychology. Thank you.